For me, working in a hospital is very rewarding. I believe that everything I do supports and has an impact somehow on the families and patients that we care for. Work in a hospital, it makes you accountable because, like I say, even if I'm an executive assistant or a secretary, it's still every little thing counts for the bigger picture, the healthcare of the children and the pregnant mothers, but makes you be more responsible, more professional, and just more hardworking, I think, than working in any other field, because here it's lives that we're talking about.
So in the transport setting, there's often times where you're on your own, and whether you're in an ambulance, in a helicopter, in the fixed-wing aircraft, you might be it. There are occasionally days where some kids are very sick and they need transport to an ICU level facility as quickly as you can do it. And given the situation, it involves a lot of critical thinking, that's for sure. Anything can arise from the child's heart stopping beating, the child may have trouble breathing, and if you're on your own, you really just have to keep your wits about you and think critically about what's best for the child and what's going to get you back safe.
I'm an educator. I teach nurses and other people who are taking care of moms and kids by helping them to understand something that's new or has to change. They're then going to be able to turn around and apply that to their practice and provide better care. So early on in my career as a staff nurse, I learned that with new people coming in, I could make a difference indirectly in how they took care of patients by helping them to connect the dots and deliver great patient care.
My job has always been about the patient's experience, and every single program that is at the Children's Hospital has to do with comforting the patients and families and making it as easy as possible for them while they're here. Again, it's all about our patients and families, and the luck I have that in my job that I'm fortunate to have every single day is I get to know a little bit about all these wonderful things, and I just feel really fortunate that I get to know a little bit about all of it and I get to participate in it.
Like any Filipino family, nursing runs in my blood. My mom is a nurse. I have aunts on both sides of the family that are also nurses. I'm also the oldest of 3 girls and the oldest, most mature cousin on both sides of the family. So I'm a natural caregiver at heart. Ultimately, I knew I was destined to be a nurse when my grandma got sick. My sophomore year in college, she got cancer. And when she got sick and I was in school, I was taking care of her. She stayed at home, and I was the only person at her bedside when she passed away. She always wanted to become a nurse, but was never given the opportunity. And although she's not able to see me as a nurse, I'm sure if she were alive today, she would say that her dream had been fulfilled through my success and accomplishments here at Lucille Packard Children's Hospital.
Working with a family, a new mom about to deliver, is very rewarding. You're facilitating in one of the greatest moments in their life. It's just a privilege to be there and to see how close the couple are and how they work together, how supportive the husband or the partner is. And in some cases, it's their first and only child. And in some cases, their second or their fifth. Or like in this case, their ninth.
35 years has gone by very quickly, and I think part of it is that when you do something every day, you look forward to coming to work, you really believe that the efforts that you make contribute to helping the most vulnerable, and that's sick children and expectant mothers, that it makes my work meaningful. I hope that it makes everyone's work meaningful. When I first came to Packard, one of the reasons I moved over from Stanford is I thought one individual can have a greater impact in a smaller institution. What I've found over the years is that it's the cumulative, the combined effort of all of us. That's what really makes a difference.
I feel appreciated, especially by the patients and the families. Not only I'm their care provider, but I feel that I'm also their life coach in a way, or their cheerleader behind them, cheering them and being really positive and saying, you can do this, you will do this. And it's a difficult thing to try and lose weight. I feel that someone needs to believe in them more than they believe in themselves. I really enjoy working at Lucille Packard. I really enjoy the people that I work with. And I hope I continue for the next 10 years. I'm really happy here.
Being in an assistant nurse manager, a nurse manager role, you're able to really focus in on those things that are going to improve the patient stay on your unit. As a manager, you really can help facilitate that whole process, make sure that primary care nursing is happening, that they're getting consistency in their care. I think that their focus is on making the stay the best possible stay for the patients.
When I became a parent of a child that was treated here, the comfort of having her treated in what I consider a second home by people that I truly care about made the stress of the situation, I was able to cope with it so much more. I knew that I would be apprised of what was going on. I knew I would be brought into the care plan. I knew I would never be in the dark because everyone was going to partner with me to help me as I was coping with my child being ill. And I can't imagine having to go through that without the support of the nurses, the doctors, the staff here. To be on the other side and see the love and dedication and care that our nurses provide to our patients is really quite incredible. And I'm inspired by the people that I work with. I'm inspired by the dedication that I see with the other staff at the hospital. When you see a nurse or a physician take that extra step to make the patient or family more comfortable or make them more ready to be cared for here, that inspires me.